Welcome back, and in this part, I'll talk to you about the celiac disease, also called gluten sensitive enteropathy or celiac sprue, or in the British English they call it, it is written as coeliac disease. It is the same, the celiac. And what it is a permanent intolerance to gliadin. Gliadin is a protein that is present in different components or different dietary components like wheat, barley, rye, and oats. So those patients cannot tolerate eating any of these stuff. The wheat, the barley, the rye, and the oat because of the gliadin. And this is a lifelong inflammatory condition of the GI, so usually affect the small intestine. And these patients are genetically susceptible because they have autoantibodies against the gliadin, and the presence of gliadin would create an inflammatory or immune reaction. And because of that, the patient or destruction would happen to the intestine, and the patient would suffer from malabsorption and diarrhea and abdominal pain. So this condition is really prevalent, and the prevalence of this condition has been increasing excessively, becoming more and more prevalent. There is also anti-endomysial antibodies are detected in higher percentage of in the population. So many people, they have the antibodies, but they are not presenting the disease, which I'll discuss later in the coming few slides. And also it has been noted that there is a familial clustering of the condition, and also the first degree relative of those patients, although they are not having the disease, but they have the autoantibodies, and they have what we call as a leaky gut, which means that their gut is affected, and they allow the entrance of several proteins that shouldn't get through to the tissues, but still they do not develop the disease. Another thing is that autoimmune diseases usually occur in clusters. So patient with the celiac disease is far much more susceptible to develop other autoimmune diseases, including diabetes, insulin-dependent diabetes, or rheumatoid arthritis, or different autoimmune conditions. So things would become clearer in the coming few slides after we discuss here the what goes on in a celiac disease. So this is an example of the normal gut, and you see here, this is the lumen. This is the lumen of the intestine where the food stuff comes through. And what we tend to do is to absorb these substances through the villi that are located in the intestine. And so these are the cells of the intestine, and they have these microvilli, as you can see, that will increase the surface of absorption, and we tend to get these substances here. It gets through the cells, being processed there, and then released to into the deeper tissues to be absorbed through the vascular system there. So this is what happens normally. And in people with gluten insensitivity, the gluten here, which is like present in the wheat or barley or whatever, they get through. They are being absorbed. However, they do not have the enzymes needed to degrade this substance, so it get as is, and gliadin get as is into deeper structures. Also, they have antibodies that would bind with these with the gliadin, we have the transaminase enzyme that convert the gliadin into aminated form of gliadin, which is even more immunogenic, and this would initiate an inflammatory reaction. This would be taken by antigen presenting cell. It will present it to the T cells and create an inflammatory reaction. So this is one of the mechanisms how gluten induces allergic reaction or inflammatory reaction, let's say, in gluten intolerant patients, because they cannot degrade this substance. They do not have the adequate enzymes needed to degrade the substance. Also, another mechanism, I'm not sure if, no, it's not there. Another mechanism is that these people with celiac disease, they express different markers, let's say, or different proteins on the surface of these villi that would create gaps between these enterocytes, these cells, the intestinal cells. So having these gaps between these enterocytes will allow the gluten or the different substances to get in between the cells without being processed within the enterocyte. So this would allow the gliadin to get through to the lumen here, and it is an antigenic substance. It will create an inflammatory reaction, while in a normal human being, these enterocytes, they have tight junctions, and in this case it will prevent any substances, any food substance or proteins or structure to get in between the cells. They have to go through the enterocytes here, and they have to be processed first before they get deep inside into the tissues. So this is another mechanism how celiac disease can take place. And this is what has been noted, that some people who are actually do not have celiac disease, and this has been noted in many let's say first degree relatives of the celiac disease patients, they express certain molecules or proteins that will make the gaps between the enterocytes loose. So as there is more spaces between the enterocytes, more substance to get in between these cells without going through these cells themselves, without being processed. So having this problem, either the leaky guts or missing certain enzymes that tend to degrade the gliadin, would initiate an inflammatory reaction. So this is how celiac disease takes place, or one of the let's say theories to explain the pathophysiology of celiac disease. And what happens in result of that is, as these substances are being absorbed through the villi here, it goes deep to the blood vessels. In a celiac disease patient, this will create an inflammatory reaction, and this inflammatory reaction will lead to damage of these enterocytes. So these are the enterocytes. In a normal healthy person, these enterocytes have very tight junctions in between, so anything is to be absorbed through these microvilli, it has to go through the cells themselves, being degraded there, processed there, before they get into the lumen here. While in celiac disease, these enterocytes are being destructed because of the inflammatory reaction, and they are leaky, so allow these inflammatory or these antigens to get deep into the tissues here, created an inflammatory reaction. This inflammatory reaction, of course, will damage these enterocytes. So the number of enterocytes would reduce, and this is why the villi becomes so reduced, so flattened. And this is why in a celiac disease patient, the patient will lose these villi. There is no villi here, and of course this would reduce the absorption, and this is why the patient would have problem with the absorption, loss of nutrients, loss of fluids, loss of electrolytes, which will expose the patient to the disease, all the symptoms of celiac disease. This is the problem of celiac disease. How it is presented: because there is severe inflammatory reaction, there is no absorption of sufficient dietary, so most of the fluids, electrolytes, dietary substances will be lost, so the patient would have diarrhea or loose stool because there's loss of fluids, they are not reabsorbed, they are lost, and loss of appetite, weight loss, of course, anemia, and electrolyte imbalance, and sometimes it gets so serious that the patient had to be hospitalized. How to diagnose it? Again, by biopsy. So we need to take a biopsy from the small bowel, see these changes, the flattening, the loss of the villi and the enterocytes. We do blood tests, and we test for the presence of autoantibodies, the anti-gliadin, the anti-reticulin, and endomysial autoantibodies. They are positive in those patients. And some patients have positive blood tests, but they do not have the changes within the small bowel seen in the biopsy. So in those patients, they should, stop taking gluten to prevent the progress of the disease, because they are susceptible to develop the disease, and they have to watch out for developing the full-blown Crohn's disease. Celiac disease. I'm talking about celiac disease. And this is what we are talking about. So we are just seeing the tip of the iceberg. We are just seeing the patient with a symptomatic celiac disease. Many patients, they have silent celiac disease, which means that they have a positive autoantibodies. They are tested positive for antibodies, and there are some mucosal changes by doing endoscopy, but still they do not have the full-blown clinical picture. They do not have diarrhea, they do not have malnutrition, so they have not reached to the symptomatic celiac disease. Other group of patients, they are positive for the autoantibodies, but there is no mucosal lesions, so they are sort of a latent celiac disease, which means they might move they might develop mucosal changes, and they might develop a full-blown celiac disease. Of course, there's a possibility that they will remain latent forever or go up to the silent celiac disease without ever developing any symptoms. However, this is what has been found by doing the studies and testing of the relatives of celiac disease patients. Other than the GI presentation, celiac disease can be presented with different manifestations. The main one is the skin manifestations, the dermatitis herpetiformis. The oral manifestations are the ones related to malnutrition, hematinic deficiencies, and if this occurs early during the development of the teeth or early during the child development, this would affect the child development growth and would affect the teeth if the symptoms start to show while the teeth are being developed or during the development of the teeth. Other signs and symptoms or manifestations are actually manifestations of hematinic deficiencies, glossitis, angular cheilitis, and RAS. How to deal with it? Just avoid gluten. That's it. You don't need to go to have steroids, sulfasalazine, other anti-inflammatory or other immunomodulatory medication. Just avoid gluten and things will get back to normal. Of course, initially you need to correct for the deficiencies that happened, and then once the villi are restored, normal function is being restored. Most of the patients still would need to rely on supplements to maintain good levels of iron. So this is for the all what I wanted to share with you regarding diseases affecting the GI system. Hope this makes things clearer to you, and see you in the next lecture, inshallah. Thank you very much, and bye-bye.